Welcome to Therapeutic Monitoring Systems, enabling the next generation of clinical decision support. Critical care hospital monitoring equipment produces a steady stream of patient vital sign measurements. This monitoring information is displayed continually for use by critical care physicians and nurses, but this view alone is insufficient to accurately determine a patient's condition. Why? Because current standard of care monitoring information offers only a brief snapshot of patient data, providing limited or no insight into what is likely to happen to the patient over the next few hours or days. At Therapeutic Monitoring Systems, we're applying patented techniques for processing large amounts of raw waveform vital sign data to produce derived views that directly support specific critical care decisions. This information supports what we call anticipatory patient monitoring. In other words, more accurate and earlier determination of a patient's trajectory, offering improved prediction of what will happen to the patient rather than simply reporting what has already happened. We're applying vital sign variability analysis to create a range of products, each one designed to support the decisions for a specific clinical event. Let's see how it works. Every year in the US alone, over 1 million patients in the ICU are on mechanical ventilation, and one of the most challenging decisions faced by clinicians is the determination of when a patient is ready to be weaned off the ventilator. Today, a clinician will dial down the airflow and observe the patient for 30 minutes, conducting what is termed a spontaneous breathing trial. Decades of independent clinical studies have shown that there is significant predictive information contained in the variability or patterns of variation of the patient's raw waveform data. But these variations are almost impossible to see by viewing the data directly on conventional vital sign monitors. Let's take a closer look. Delivered to clinicians on any browser-enabled device, TMS transforms vital sign waveform data to produce information that is unavailable using standard vital sign monitors. By providing multiple views of the data, we can illuminate distinct changes in such things as breathing variation, a change that would be impossible to detect by observing the patient directly. Here we see the same patient data displayed graphically, highlighting a pronounced change in the variability of breathing for this patient. This pattern could not be detected by watching the patient or their respiratory waveform trace on a conventional vital sign monitor. This drop in variability is clinically important as less variability identifies that the patient is under more stress, is more fragile, and less able to withstand removal of life support. Therapeutic Monitoring Systems is taking this methodology further and has developed proprietary algorithms for combining variability data from multiple vital signs to create composite vital sign indicators that support specific types of medical decisions. TMS is developing an array of FDA-cleared decision support applications that provide actionable information to physicians and nurses leveraging the monitoring equipment that already exists in every hospital. Vital sign variability analysis can help physicians answer the toughest questions and consequently make better patient care decisions. For example, is a patient ready to be removed from the ventilator? Or is a patient with symptoms of infection improving or deteriorating? And with the largest vendors in the medical device industry like GE and Philips investing in bedside clinical decision support applications, Therapeutic Monitoring Systems software is being developed to seamlessly integrate with standard monitoring equipment to provide bedside clinical decision support accessible through web-enabled devices like PCs and tablets and integrated into patient care workflows in the hospital ICU or emergency room.